It's American Heart Month, so let's talk about heart disease as it pertains to the GI tract. For many years, we were unaware of a correlation between a healthy GI tract and heart health, but now we know otherwise. I'll talk about the correlation in just a minute, but for now, let's discuss some statistics. Heart disease is the leading cause of death in the United States for both men and women. According to the CDC, there are more than 18 million people in the US with coronary artery disease, and in 2017, over 365,000 people died of coronary artery disease. Here are the risk factors for heart disease: tobacco use, diabetes, hypertension or high blood pressure, high cholesterol, family history of heart disease, obesity, unhealthy diet, and a sedentary lifestyle. So how are we doing in this country to treat or prevent heart disease? Well, in the realm of treatment, we're using drugs such as aspirin and statins, which are sometimes very helpful, but let me encourage you to prevent heart disease to avoid the need for these medications. How? By eating predominantly a whole food plant-based diet, which is high in fiber and low in saturated fat and devoid of cholesterol. So let's talk about the relationship between the heart and the GI tract. It turns out that there are 100 trillion gut microbiome living in our intestines from mouth to anus in a symbiotic relationship. Our GI tract acts as a bioreactor, and it produces thousands of molecules through enzymatic reactions by the gut microbiome as the result of the foods that we eat. An example of a molecule is one called TMA or trimethylamine, which is produced in the gut by the gut microbiome. TMA is metabolized in the liver and converted to TMAO or trimethylamine oxide, which is very inflammatory and causes atherosclerosis and coronary artery disease, which is the most common type of heart disease in the United States. So, do you know what foods cause the production of TMA? One example is red meat, which contains carnitine. Carnitine is converted to TMA by the gut microbiome. Another example is eggs, seafood, and cheese, which contain a lot of choline. Choline is also converted by the gut microbiome into TMA and subsequently TMAO. So whereas the egg industry is pushing you to eat a lot of eggs, and the dairy industry is pushing you to eat a lot of dairy, and the meat industry is pushing you to eat a lot of meat, I highly suggest that you do otherwise, because eating those foods lead to the production of this inflammatory molecule called TMA and subsequently TMAO, which causes heart disease. Thank you for listening. I really appreciate it. Eat some plants, eat a whole food plant-based diet to prevent heart disease. #Dr. Angie Sadeghi, #American Heart Month.